And Dr. Sauzer, tell me what scientists kind of need to understand when we talk about restoring function in people. I know that that is the big kahuna. That's the one you're all searching for.
Well, yeah, I think we've already anticipated it to some extent with the conversation. But so obviously, first of all, the foundation has to be that you prevent further damage, and there have been fabulous strides in that regard. But I would say there are two areas that there are also wonderful advances that in my area that we need to understand. One is how these cells communicate and how they're organized. So I mentioned before, the nerve fiber is not a uniform structure. It's completely reorganized by the myelin sheath. There are a lot of molecules that are exposed with demyelination that short circuit the electrical impulses and that are probably targets of the immune-mediated attack. So we need to know, we've made a lot of advance from, in the last 10 years, it's a night and day, but I would say there's still important insights to come from that and also new targets to prevent neurodegeneration. But the big area, of course, is in the area of making new myelin. The ultimate goal of neural repair is coming up with coaxing the cells to make them make new myelin sheaths. And again, I think what are the signals that impinge on progenitor cells and in our own work, and I just want to pick up on something that Dr. Frohman mentioned, collaboration. So the MS Society and its wisdom had these collaborative center awards. And just to underscore, it brought my lab together with several other labs at NYU, stretched us in new directions. We could take a flyer, and it led to a whole new program, which is, we're about to submit our findings after years, that stem cells can be recruited in the adult brain. Stem cells get recruited into a lesion site, and we've heard about LINGO, there are other pathways. We've identified another pathway that if we inhibit it, we can route those stem cells more effectively into demyelinating lesions and get them to repair more effectively.
So we're looking at the possibility of stem cell research as well, which is fascinating. Dr. Coetzee, I want to get back to you and talk about chronic progressive MS. And I know we've always heard that there are two kinds, relapsing, remitting, and chronic progressive. And one of the frustrations I would imagine for people with chronic progressive, and I include myself among that, is rarely does a new treatment seem to apply specifically to us. Can you talk a little bit about whether or not there are some treatments on the horizon for that, and how you talk to your patients?
Sure. No, that's a really great question. I think we hear that every time a new drug gets approved. It's approved for relapsing forms of MS, and that's great, but it's great to have that progress, but we need to do something about progressive MS. And one of the things that it's important to know is that virtually every drug that has been approved for relapsing MS has been tested in the progressive forms of the disease, and it hasn't been successful. But that failure doesn't mean that we haven't learned anything from it. And what we have learned is that there's probably something different going on in progressive MS, and there's something about the biology that's not there. So we really need to understand the biology of what's happening in progressive MS. We also need to continue to think about how we do clinical trials and test new drugs in different ways. And at the meeting that Cindy referenced in France, there were some studies that talked about new ideas and new concepts that potentially could lead the way to new treatments for progressive forms of the disease. So I think those two are one part of it. I think the other piece, coming back to the theme of collaboration, is that we recognize, I think the entire community sees that we're not going to crack progressive MS by ourselves working individually. So we're partnering with 5 other MS societies to create an international collaborative to address that, to really fund research around the world. With really a very simple proposition is that we've had this amazing success in getting new treatments for relapsing or remitting MS. That's taken a long time to get there. And so the question we have is, with this collaborative, can we shorten that window so that the conversation when you're diagnosed with secondary progressive or primary progressive MS is, let's talk about the treatments that are available.
And do you clearly see that as two different forms of the disease? Because I've often heard over the years that relapsing remitting may often sort of translate itself into progressive.
So since I'm not a card-carrying neurologist, I'm actually going to let the card-carrying neurologist answer that question. But I will say that, the science is telling us that there is, it's evolving, but it's getting complicated. And that's why you need to do work like Jim's doing and Elliot is doing to really understand how the disease evolves over time. And we're funding some studies to really ask, there's 1,000 individuals who are participating in a study that are going to be followed over time to see what happens to progressive MS and what changes. And that's the kind of work that we can do with the support that the society provides.
Well, I've got just one mundane question, and then we are going to try to wrap this up. And it's a topic that may make you a little queasy after you've just had something to eat, but we've heard about MS research relating to worm eggs. Eating worm eggs. And I know that we're probably oversimplifying this, but are you looking at things that do have to do with bacteria and gut research and that sort of thing? And I really throw that out to all of you all.
Yeah. Well, one of the hypotheses that has evolved around MS since people started systematically looking at it, you might say that stems back to 1946. When Sylvia Lowry really started the National MS Society because her brother had the disease and there were no established treatments. But what we have seen that's been very interesting is that rates of multiple sclerosis are not willy-nilly. They're not evenly distributed. We tend to see more MS as you move away from the equator. Now we seem to think that may have something to do with diminishment in sunlight exposure and vitamin D mechanisms. We've also seen that it doesn't affect people equally across sexual issues, males and females, women are more affected, racial issues. So we've learned a lot about what MS does in terms of who it likely affects, how it happens, where in the world it happens. But we've also learned something very important, and that is, as individuals in society move from the third world to the second and into the first world, when we've cleaned up the water and sanitation and nutritional challenges, we begin to see an expansion in the number of people who have autoimmune diseases like MS. So one of the hygiene hypotheses, one of its facets, and that's what this is called, is that as individuals move to a more urbanized, modern life, clean up the environment, your exposures early in life are actually different than they might have been had you just been in the environment and easily exposed. There's a guy by the name of Jorge Coriale in Buenos Aires, Argentina, who trained as a neuroimmunologist at USC with Les Weiner. And when he returned, he began to look at individuals with MS and those in the community who were matched but didn't have it. And a very interesting observation was made. And by the way, in Argentina, there is MS. It's probably about 30% the rate that it is in the United States. Individuals who had multiple sclerosis appeared to not have immunologic evidence in blood measured by their antibodies.
Translate that. What does that mean?
Well, you could take blood samples and show that individuals who had MS were different than individuals who didn't in terms of showing evidence in their blood that they had been exposed or not exposed to flatworms. And the early life exposure to this particular infection conferred some benefit or advantage. And very simply, why? It may be that early life exposures is a way to educate the immune system on something that's very complex, but it's a simple word. It's called tolerance. The ability to go after viruses, parasites, fungi, but at the same time to recognize our own proteins and recognize their self and not go after them. We think may have something to do with the education, the critical period of the immune system's education on what is foreign and what is self. So some very bright people found that when you didn't have MS in Argentina, there was a much higher likelihood you were exposed to the worms.
So we're all going to be eating worm sandwiches very soon. I'm in total agreement with that. Dr. Coetzee, you were the one person who didn't get a chance to sort of say what you were most excited about, so I'm going to let you polish this off for us.
So I'm excited about this amazing panel. You know, the fact that, we can have this conversation and that we can talk about worms, myelin repair, all over lunch. Isn't that great? I'm excited. No, I think what I'm really excited about is the fact that, we talk about a shared promise, and it's a shared promise of these researchers with everybody in this room, of being able to really raise the resources we need to move into these new areas like worm research or nutrition, or bringing the young talents who are here and who, all those young researchers that, get their start, the 800 fellows that we've trained over the 50 years that the Society's been training fellows, the kind of impact that we can have. I mean, imagine we're rewriting the story of MS.
Yeah.
And that's what excites me, is what the future can bring, along with these great scientists.
And we're looking at more oral medications,
we are.
we all hope, right?
We are.
Instead of having, yes, exactly.
Exactly.
More oral medications.
Exactly.
Well, I have to say, I'm excited that I had an opportunity to sit down with all of you all and chat for a few moments. I know that a lot of the folks out here are very interested to hear what you have to say. And we want to thank both the MS Society and researchers like you for collaborating on so many answers to what has been such a puzzling problem for a long time. If only you could teach this to the White House and Congress, we'd be in business, right?
We're working
We'd love
on it.
to see a little bit more collaboration there. But thank you all very, very, very much. And I have a feeling you're going to be waylaid by a lot of the people out here to hear more about it. So thank you.
Can I say just one last thing?
You can say one last thing in about 10 seconds.
In my 3 decades of being in MS, when a fellow or a student, a medical student, would come to the MS Center, I would always ask before they started to saw a patient, what do you see in your mind's eye when you think about MS coming to my clinic today, first time?
Right.
Almost uniformly, they would say, I see a young woman in a wheelchair. To let you know how breathtaking the morph has been, today when students come and I ask them that very same question, what's in your mind's eye? The most common answer now is, I'm in the waiting room and I'm not sure who has MS or who is here with a patient with MS.
Absolutely.
That is shock and awe
Absolutely
change.
true. That is
Major.
absolutely true. Thank you so much for bringing that point up. And what a perfect place to end this discussion, because there have been so many dramatic changes over the last couple of decades. It is incredible to really hear about just the scope of all of the work that is going on. And believe it or not, this only touched on things. This is really just the tip of the iceberg. As I say, you'll want to waylay these gentlemen and lady a little bit later on and ask them some questions. I also want to be sure to congratulate 2 of our panelists who will be inducted into the Volunteer Hall of Fame this evening. Dr. Gilmore, Dr. Sauzer, congratulations to both of you. That is fantastic. And a belated congratulations to Dr. Frohman, because we know you've received this award in the past as well. So we want to say thank you so much. So not only are they great researchers, they're also great guys and ladies. So we appreciate that very much. Thank you all, and I want to turn it back over to our MC.